Hello, everybody. I'm Jenny LeRae with Research America. Welcome to today's Alliance member discussion. We're delighted that C-SPAN is carrying today's presentation and discussion on C-SPAN 1. Thanks so much for joining us on Zoom and for your partnership in the Research America Alliance. If your organization is not a member, please stay on as a guest, but afterwards get in touch with our colleague Joel. His email is in the chat, and he can talk with you about the wonderful value that comes with being an Alliance member. Our special guest today is Dr. John Balbos, Interim Director of the Office of Climate Change and Health Equity at HHS. Dr. Balbos will be speaking with us today about the importance of this new office and how it intersects with the research community. I know we're going to learn a lot, John, and we're going to have a lot of questions for you when you finish your presentation. Thank you so much for joining us.
Great. Well, thank you so much, Jenny, and thank you to the Research America staff for setting this up today, and of course to everybody who's on this morning. Thank you for joining us. This is the week before the last week of summer, in some ways before Labor Day. I really appreciate the opportunity to speak to you about the issue of how climate change impacts health equity, and then the role of the new office that we've created. And I'm going to start just with an image, and this is an image that I think resonated. It's a year old now, but it's first of all an acknowledgement that in 2022 we're still in the midst of a pandemic that has stretched and challenged our healthcare delivery and public health systems in a way that nothing has really for many decades. And yet, even in the midst of this pandemic, as this image shows, we have a senior center caring for one of the populations most vulnerable to the impacts of climate change and to the impacts of COVID. That the people in this area, this was from the Vacaville area fire, had to be dealing with climate-related catastrophes as well. This was a drought-fueled wildfire that was creating serious smoke inhalation problems for a wide area, and is just symbolic of the fact that even as we have to be taking steps to be recovering from the stress of the pandemic and rebuilding our health systems in a way to strengthen them in the space of pandemic preparedness, that at the very same time we have to be thinking about the climate-related stressors that are upon us as well. And of course, it wasn't just this wildfire. This is the graphic from NOAA showing 2021 and the large number of billion-dollar weather and climate-related disasters that were all impacting the health system's ability to deal with COVID, whether that was the multiple hurricanes striking the Gulf Coast and the hospitals going down there, whether that was the numerous wildfires in the Northwest, the heat dome in the Northwest that were stressing the systems and making it hard for people to shelter in their homes if they didn't have good filtration, and on and on. So again, just a visual and important reminder that our health systems are addressing climate-related health threats now. It's not a future issue, it's a now issue, and that we don't have the luxury of dealing with these threats one at a time, that they happen simultaneously, and we have to have systems that are resilient to multiple simultaneous events. And this is just a reminder why climate change, even as it's happening now, is an issue where action is so urgent because we have delayed action in definitive steps to reduce the greenhouse gas concentrations in our atmosphere to lessen the impacts of climate change. And so I just want to recall some of the recent literature. This was a NOAA story about the most recent Intergovernmental Panel on Climate Change, or IPCC report, that made the case that that we were very close to the Paris threshold, and that the time until we reached a 1.5 degree Celsius increase, which the scientific community tells us is a threshold beyond which we will be suffering even more greatly than we're currently suffering from the burden of climate-related health threats, that the time that we have to turn things around is shortened. It's about 7.5 years. But the report also noted that means that there is 7.5 years until we get there, and that really definitive actions taken now will have a big impact. So it was this mixed message that the urgency is here, and yet there is still time to make that difference. And that's why having this office and bringing the health sector into the battle against climate change is so urgent and so timely. A somewhat unprecedented event happened last fall, which is that the 200 of the world's greatest medical journals came together as one to publish a singular statement calling climate change the greatest threat to global public health. So at least the world of academic medicine and medical journals has really recognized the centrality and the urgency as well. And this was a more recent update that came this past spring, which was, again, just a clarion call that that there was actually a 50-50 chance from the World Meteorological Organization, or WMO, of reaching that 1.5 degree threshold in just 5 years. So in other words, the clock is ticking. The flip side of getting the health sector into this is the positive note. And this is something that I find is very unrecognized, that the research community has contributed. When I very first started at the National Institute of Environmental Health 13 years ago, we were just publishing that the first major Lancet publication summarizing the knowledge about the benefits to health that come from reducing greenhouse gas emissions, often because of reductions in air pollution. So this is just one of numerous studies. This one was specifically looking at the co-benefits and the value of the benefits to health from reducing air pollution when you reduce carbon dioxide emissions because you reduce fossil fuel combustion. So this is just about fossil fuel combustion and mostly the particulate matter and the ozone air pollution that comes with burning fossil fuels, which we know is responsible for many millions of deaths. 7 to 8 million of deaths come from air pollution of various sorts, and about half of that from fossil fuel combustion in the world. So this is a study that said if you put an economic value on the lives saved and the reduction of health costs associated with reducing that air pollution, it actually pays for the greenhouse gas reductions. I'll say it again. The economic value of the health co-benefits were greater than the cost of achieving the Paris Agreement target. That's a message that the health sector owns, that it should be the first thing that we say, that it's not just that we need to reduce climate change to keep the climate stable or to protect glaciers or polar bears. It's that the human lives saved pay for it. The human lives saved, the value of life that is saved pays for the step in the first place. Just want to make sure we're all hearing that. Let me take a few minutes to just remind ourselves, what are we talking about when we say that climate change is one of the greatest public health threats, is the greatest public health threat of the 21st century. And this is a slide borrowed from colleagues at CDC that shows in the center four of the primary manifestations of a changing climate or increased greenhouse gases. So rising temperatures, more frequent and more severe extremes of weather, like the disaster slide from 2021 is an example of what we might be expecting. Rising sea levels from the thermal expansion of the sea levels and the melting of polar and glacial ice, and then the impacts of increasing CO2 itself. Around there are 8 different ways that those primary changes in the Earth system impact human exposures, whether that's through, on the top left, changes in heat waves and storms. On the right side there are changes in our ecosystems and changes in tick life cycles, for example, or mosquito life cycles, or changes even in the very allergenicity of pollens or the concentration of pollens associated with changes in seasonality. And then the bottom left are some of the more existential issues related to loss of water supplies, loss of arable land, especially, for example, in low-lying Pacific islands, or loss of the land you live on itself, as so many tribal communities are facing now in Northwest Alaska because of the loss of Arctic sea ice and the erosion of the very land that they've lived on for centuries. And so the bottom left are the more societally disruptive stressors, economic stressors, severe mental and emotional well-being stressors that are happening on the front lines now in places like the northwest coast of Alaska, the coastal Louisiana, where the tribes there have lost 90% of the land that they had been living on from combination of loss of the delta and sea level rise, etc. So bottom line, if you're into health research, just about any health condition that you're researching, whether it's organ systems like the heart and lung system, the kidney system, whether it's mental health, whether it's the interaction between society and healthcare delivery, there are many, many different topics climate change is touching on the mainstream of health, is the point I want to make. The impacts are broad enough that virtually all aspects of health and healthcare are being impacted by the changes that we're seeing in either seasonality, climate, or extreme weathers and disasters. So into this space, President Biden signed Executive Order 14008, which is a very broad-reaching executive order tackling the climate crisis at home and abroad. One section, Section 222, gives a lot of mandates to the different departments, and the mandates given to the Department of Health and Human Services were to create this Office of Climate Change and Health Equity, as well as to stand up a new interagency working group to protect the people in America from the impacts of climate change, especially those most vulnerable and at risk, and also to create a healthcare system readiness advisory council. So I'm going to spend the next few minutes talking about the office and how we are approaching what is an increasingly broad task and set of goals. So our office was created within the Office of the Assistant Secretary of Health, and we are situated alongside, for example, the Office of Minority Health, the Office of Population Affairs, the Office of Women's Health, as one of the cross-cutting offices within the Office of the Assistant Secretary of Health. We were about to celebrate our first birthday, officially created August 30th. That's tomorrow. Will be our toddlerhood, our first birthday. And within a few months, the picture here shows the Assistant Secretary of Health in Glasgow at the UN conference meeting known as the Conference of Parties, or COP. So this was the COP26 meeting, and Admiral Levine led the first ever official government delegation from the Department of Health and Human Services, and is here announcing our commitment to the COP26 health program. And the aspects of that health program are what you see at the bottom of the slide. We committed to resilient communities and health systems, and also to the decarbonization of the health system in the U.S. The resilience, I'll talk a little bit more in a second. The decarbonization, we committed to helping to coordinate and accelerate the greenhouse gas accounting and greenhouse gas reductions within the federal health system. And of course, the federal health system is the minority of the nation's health system. And so we committed to control what we could control, but also to partner and enter into a public-private partnership with the private health sector to help to develop an action plan for reductions in the private health sector as well. And we laid out this very ambitious vision for the nation that our office was going to be dedicated to by 2025. That's now, nearly 2 years away, just about 3 years away. That we would be working to have only every health system, but every community in the U.S. as prepared as possible for the disruptive, acute, and the chronic climate impacts, especially on those most vulnerable, as well as the facilities to be prepared for increasingly severe weather-related disasters, and then to have the hospitals and health systems tracking greenhouse gases and being on a path to net zero by 2050 by tackling all three of the scopes, the direct and the indirect emissions. And very importantly, we recognize that, again, we're within the federal government. We don't control the entire nation's health system, but we have influence over the other parts of the Department of Health and Human Services. And so we've committed that every major operating division of Health and Human Services would be on board and contributing to these goals as well. So part of the way this is being done is through the HHS Climate Adaptation and Resilience Plan. This was published a year ago. This was another of the mandates of the executive order tackling the climate crisis at home and abroad. And we laid out 5 priority actions. The first was building on those existing programs at NIH and CDC, the NIH Climate and Health Program that I had come from, and the CDC BRACE program, and to expand those. A lot of our work is all encapsulated within that second priority action that was to improve HHS responses overall. And that's a lot of what we've been doing in this past year, is that work with each of the divisions one by one to develop their divisional climate adaptation and resilience plan and agenda. And within this plan, we're partnering with the Sustainability Office of HHS to improve the climate literacy of the HHS workforce. So, pardons for the Microsoft-related glitches in this diagram that make it a little hard to read. If you're seeing what I'm seeing, I apologize for that artifact that somehow comes into things. But this is one way that we think about what we're trying to accomplish as an office. And I'm using the model of a driver diagram on the left. You see the primary aims, and they're fourfold for us. They are to protect people from the health impacts of climate change, to make people climate resilient, communities and individuals. On the bottom left, we recognize, and this is one of the ways we divide or set our goals, we recognize that one of the reasons that people are more likely to be harmed by climate change, especially in areas of some communities of color, low-income communities that have been experiencing historic structural racism and disadvantage, is that all of the social determinants of health in those areas tend to be degraded. Housing quality, access to transportation, access to safe and healthy foods, access to safe and healthy places for recreation, quality education, all of these things, the primary social determinants of health, are leading to health disparities in those areas and increased rates of chronic health conditions like asthma, like diabetes, like depression and anxiety related disorders. All of these things are associated with those upstream factors, and all of them contributed to people being more likely to have a bad outcome in a heat wave or a flooding event or a wildfire smoke event. And so one of our aims as an office is to be working on those upstream social determinants of health, because many of them are related to the infrastructure, especially in our urban areas. And there are big changes coming to our infrastructure because of climate change and the investments being made through things like the bipartisan infrastructure law or the Inflation Reduction Act. So one of our goals is to enhance health equity through raising those connections. And this is a big research and evidence-based area as well. How interventions for walkability, for green space, for enhanced tree canopy, for reflective surfaces on housing, for enhanced insulation in low-income housing, how all of these things help to make people healthier and more resilient in the face of climate-related threats. And then the other aims there are for resilient health systems and low-carbon health systems, very much along the lines of the COP26 health program. And the drivers that we're working to influence, the ways that we'll get to those 4 aims are, first of all, the health sector in general and HHS was not the first mover on climate change in the way that other sectors were. People felt that many people felt that climate change was an environmental issue, not a health issue, and so there's really a need to describe how these things fit together. Why is it that climate change should be part of the mainstream activities of the Department of Health and Human Services? And so part of our office's goal and role is to set that vision, to provide that leadership to the other divisions, and to help point to an evidence-based agenda. What does the evidence say are the things that we need to do in order to accomplish those goals on the left? To build the evidence-based by compiling existing evidence and helping to steer research and analytics to build evidence for other types of interventions for communities and health systems. There's a huge first awareness raising and then skill building for the health workforce across all of the parts of the health workforce. To move things quickly, we need to have communities of practice for health systems, for all the different types of facilities, the different types of providers, communities of practice for local health departments and local municipal emergency preparedness agencies, to be able to understand the best practices for climate resilience. And that's a lot of what we're doing. The fifth area is to increase awareness and increase access to existing resources, whether those are technical assistance or financial resources, and to expand those to the scale needed to be able to meet the adaptation gaps. And then lastly, once we've done everything else, is when we can look to level the playing field by creating incentives, especially for essential hospitals and hospitals serving low-income communities that are stretched to the max now, but also to create standards, regulations within the systems that do that to level the playing field as we identify the best practices and have adequate supports in place. So in our first year, with that as one of our rubrics, we've been able to accomplish a lot, especially in the realm of the convening, the development of communities of practice, and some of the literacy raising and outreach. So we have created or supported the creation of a community of practice with the National Academy of Medicine, which about a year ago stood up an action collaborative on decarbonizing the health sector at home and abroad. We've convened as a co-chair a new interagency working group on extreme heat within the federal government to try to better coordinate and expand the federal role in protecting individuals from extreme heat waves. We have convened the federal health systems that we had committed to working on with decarbonization. So this is the Veterans Health Administration, the Department of the Defense Health Agency, the Department of Defense, the Indian Health System, which manages a lot of health systems in tribal lands. We've created a learning network or a community practice among those federal health systems to help implement a second executive order, which calls on all federal agencies to meet the national decarbonization goals of a 50% reduction by 2030, net zero by 2050. We've created a working group, the first working group within HHS, to bring all the divisions together to focus on climate change and health equity and to both develop those division-specific plans, but then find the cross-cutting collaborations where we bring these things together. We are working on evaluation and training activities to work on the climate literacy of HHS and create training modules. Very importantly, we have created a new information resource for public health departments, for healthcare delivery systems, and for people in general called the Climate and Health Outlook. This first came out in May this year. It is a seasonal forecast for health. So it takes the seasonal forecast that comes out from NOAA every month that says, what are the next 30 days going to look like in terms of temperatures and precipitation and what's the 90-day forecast, and we overlay what that means for health. So what does that mean in terms of where is the heat going to be bad? What does it mean in terms of where is drought getting worse? Where is drought getting better? What's the risk of wildfires and the areas that might be affected by that? We've brought in the hurricane forecast, and coming soon we'll be bringing in forecasts for vector-borne diseases like Lyme disease. And I'll show you a picture of that climate and health outlook. This year, we launched a pledge along with the White House to enlist the private sector in the same goals that we are working with the federal health system, to a 50% reduction in direct emissions of greenhouse gases by 2030 and a net zero for all emissions from the health sector by 2050. And so we've created a yet another community of practice that we are interacting with within the private sector to work on that decarbonization set of goals, as well as the resilience of facilities and the resilience of health systems, with an eye to protecting those most vulnerable to the effects of climate change. To start to expand that access to resources, we started a webinar series where we are highlighting the different federal supports that are available. I'll have a slide on that in a second. We've been working with CDC and the Agency for Healthcare Research and Quality on new analyses and tools to take advantage of new data sources and be able to pinpoint where the health burden of heat or the health burden of hurricane or flooding associated health impacts is the greatest. And then lastly, we have been partnering with the HHS regions, recognizing that the solutions for resilience of communities are going to be very local, sometimes hyper-local at the neighborhood level, that we as a federal office need to be partnering with our regions, which have very strong existing relationships with the state health departments and the local health sector, as well as other federal agencies, to be able to raise awareness, to bring this information on the supports, to bring this information on best practices to the local level, and to work on pilot projects together. So that's where we are at 1 year. I just want to share some images of this. So this is what our climate and health outlook looks like. This is the front page of the July issue, where you can see we have divided the country up into regions, which are the same regions that the Global Change Research Program's National Climate Assessment uses. And we provide information on what to expect in the next 30 days for those regions. So here we're highlighting the Southwest, just to show the areas, the number of counties in Colorado and southwestern states that are likely to have more than 5 days exceeding heat wave thresholds, talking about the drought and the wildfire potential. So we provide that forecast, and then we embed that in a lot of contextual information. What are the health impacts of heat? How does a drought impact people's health? What might a health department or an emergency room expect to see if they're at higher risk of heat or wildfire or drought-related health impacts? And then who are those most likely to have adverse outcomes? Who are those that are sensitive and more vulnerable to these stressors? And where are the counties that have higher or lower numbers of these different populations at greater risk? This is just a quick flash of the webinar topics to give you a sense of the kinds of federal supports we're talking about. So we started in July, and all of these past sessions are available for those of you who are interested. You can see the bit.ly down there on the bottom. If you have time to write that down, we can put that in the chat. But there are resources available for decarbonization from the Department of Energy. There's financing available for capital improvements from the USDA for rural hospitals, from HUD, from urban hospitals, and from the Treasury. And we heard from the agency for now, it used to be the Assistant Secretary for Preparedness and Response. Now it's the Agency for Preparedness and Response and the Federal Emergency Management Agency on Emergency Preparedness. And then coming up This fall, we'll hear from the EPA on the tools they have for decarbonization. We'll hear about a decarbonization toolkit that is anticipated for this fall, and then a session about the upcoming COP27. I wanted to make sure that we highlighted the fact that within our Office of Climate Change and Health Equity, we have a new Office of Environmental Justice. Like our Office of Climate Change and Health Equity, having a home within the Office of the Assistant Secretary for Health for Environmental Justice, having an office dedicated to the elevation of this issue and the guidance for the other, or the support of other divisions in creating an agenda for environmental justice within HHS is super important. To have a locus of technical expertise and a set of staff who are dedicated to this particular topic across all of HHS is a very powerful signal and a very powerful step. For the coming year, and I'll note that both the Office of Climate Change and Health Equity and the Office of Environmental Justice are awaiting congressional appropriation with the omnibus bill that came out this year. Funding for the Office of Climate Change and Health Equity had been in the House and Senate budgets, but was removed in the final omnibus. And so, we're existing in a state of limited resources that we have provided to us by the Department of Health and Human Services, and the Office of Climate Change, Office of Environmental Justice, being very new, is in a similar position. But these are the things that we can do with the resources that we have available to us to continue this coordination of federal climate change and health equity planning, and with the Infrastructure Reduction Act, the Inflation Reduction Act, and the investment in communities, our office will be helping to connect those infrastructure investments to the issue of health equity through the interagency working group that we were mandated to create. We are planning an expanded engagement campaign with communities, including the tribes, to understand, first of all, to relate what has already been identified as needs at the community level, but to bring that and to understand what's working, what's not working in terms of access to federal resources to close those gaps and to be able to protect communities sufficiently. We'll be continuing the development and expansion of the Climate and Health Outlook, continuing to grow our community of practice with the climate pledgees, and we're keeping this open until October 28th. To be able to go to COP27 with an ever-growing community of practice in the private sector on health sector decarbonization. And then lastly, the continued partnership with federal health systems. So this is how we operate. We see ourselves as a hub within the federal government between all operating divisions of HHS, working directly with communities, working with government agencies, and we're doing this despite limited staff, not just at the federal level, but also to be able to have dialogue with the state health departments, the state Medicaid directors, with local health departments, to be able to make them aware of the resources available and to start to build that community of practice among government agencies in connection with communities. The direct community of practice we have with the federal health systems, and then the two communities of practice we have through the National Academy of Medicine and our own commitment cohort with the private health sector. So I know I've talked a little long. I look forward to the discussion, but I hope we are in agreement that climate change is an existing threat that is stressing our health systems and stressing our communities and impacting people now, and is going to become worse, especially if we don't act very urgently to reduce greenhouse gas emissions. With the health sector emitting about 8.5% of the nation's greenhouse gases, the health sector is in a very important place right now to become part of the solution, not just protecting people's health, but also becoming part of the solution and reducing its own greenhouse gas emissions. And our office is uniquely dedicated to working with all of the health sector, but especially the Department of Health and Human Services to achieve this. So thank you. Please sign up for our listserv and check us out. And we welcome all input and feedback at our OCHI at HHS.gov website.
Thank you, John. That was a very comprehensive presentation about a very multifaceted problem, which your office is grappling with, and which we know the administration is grappling with overall. Couple of questions. We have got about 10 minutes. I've got a couple, and then we have a number from our audience as well. You use the term community resilience a lot. And when I was doing some research in preparation for your presentation, that came up. And I was curious to know that within Ward 7 in Washington, D.C., just a few miles away, a community that is alongside the Anacostia River, there's something called a resilience hub. And I wondered if you could provide some examples of what does community resilience mean? So what can we do at the community level to make lower income communities less impacted by the negative health effects of climate change?
It's a wonderful question, and it could be unpacked for 20, 30 minutes. It's a very rich question. Let me say a few things. The first is, there are words that we throw about, and I tried to be short, but the words like resilience, vulnerability, sensitivity, adaptation, all of these words have a lot of different meanings to different people. And the word resilience, I want to focus on several aspects of that. The first is that everybody's talking about resilience in the context of COVID, and it's completely non-climate related resilience. So the fundamental concept of resilience is that you can take a stressor as an individual or as a system and continue to function and continue to operate and eventually bounce back to a level of function that you were before. This is a definition of resilience that really doesn't work very well for our communities that have been suffering for decades of discrimination. And so within the realm of the communities most affected, we're favoring a definition of resilience that means preparing for stressors, enhancing the ability to absorb stressors, but also taking the response to stressors and doing everything possible to bring the community up to an even better level of function, because a lot of these communities have been disadvantaged for many years. So that's one aspect, is that we want resilience to be a build back better agenda. It's not just get back to an earlier level of function or dysfunction. The second is that there's a whole world of resilience and climate adaptation that really doesn't think the health sector has a big role. And then there's a whole world of resilience and health equity that doesn't think that they need to be thinking about climate change. And what our office is trying to do is really bring the two things together. So there's a lot of talk about blending and braiding when we talk about the social determinants of health. Social determinants of health traditionally have mentioned and then forgotten about the environmental determinants of health. The focus is always on food, on housing, on domestic violence, and things like transportation access, walkability, and resilience to extreme weather events are left out. And we're trying to bring those two things together, because it's the people who are living in those places and suffering from heat waves, from wildfire smoke, from flooding. They need the social determinants of health, and they need the resilience to these extreme weather events. And so our work is trying to blend the communities that are building resilience hubs for climate change, which may be a charging station, it may be a cooling center, with the people who are doing the work on resilience for health equity, which tends to be blending healthcare delivery and human services to address social determinants of health. That's about as quickly as I can do that, but it's at the core of what we're trying to do, and it's at the, what is happening now in a relatively unprecedented way is the integration of the healthcare delivery systems, the public health systems, and the health services systems within HHS to address these upstream drivers of our health problems.
John, we could discuss this for a long time. I mean, I'm tempted to ask you about what we've learned from COVID-19 in terms of community public health, but we have a number of audience questions, so we may have to have you back again. But we have a question about what your office is doing to address the mental health impacts of climate change. And also they wanted to know, is there someone in your office who is the point of contact for this issue?
We don't have a mental health with the level of staffing and support that we are at right now. We don't have a specialist or an expert in mental health. Our office has been staffed by volunteers coming over from different parts of the federal government, HHS, and so we do have a DTLE currently from the Substance Abuse and Mental Health Services Administration, SAMHSA. SAMHSA itself is taking up the issue of the relationship between climate stressors and mental health impacts, and has new reports coming out and new resources, including a new webpage that's come up. Our office is looking at this concept of resilience hubs, and there are models of resilience hubs where the hub functions as a year-round home for multiple kinds of services. And one aspect of addressing the mental health crisis that is going on currently in youth and young adults, which is being, I think, greatly exacerbated by anxiety about the future from both lived experience and also contemplation of a future of climate change, is engaging youth and young adults in direct service activities that enhance the resilience of the community against climate threats. So this is one aspect of how we're looking to address this. Our office and myself personally are highly aware of the crisis that we're in right now in depression, anxiety, suicidality, and substance abuse in this country, especially in our younger people. And we see these issues as being very much linked, complex in origin, driven by these upstream drivers, of which climate change is just one. But in thinking about resilience to the health impacts among those most at risk, the mental health aspects have to be in the center of that.
John, I'm hoping that we could steal you for a few more minutes. We're about 2 minutes from our scheduled time, but we have a lot of questions.
I'm very happy to stay on personally and happy to try to answer questions offline as well.
Okay, that's great. So a question is about, in terms of lowering carbon emissions from the healthcare sector, are there specific sources or actions in our current healthcare system that are particularly problematic? So are there certain areas that we're focused on from a carbon reduction standpoint?
There are, the short answer is that there's a lot of different sources. Nothing really predominates. If you look at the spectrum of the direct versus the indirect emissions, most of the sector's emissions come from the indirect side, from the supply chain, from the transportation of patients and goods, et cetera. So that's a very diffuse area, and that is going to depend on kind of economy-wide and kind of industry-related improvements in energy sources, et cetera. The healthcare delivery systems that we have created have been in many cases not created with an eye towards energy efficiency or low energy consumption. So there is a whole set of low-hanging fruit around the provision of energy for the healthcare facilities. So, for example, Kaiser Permanente has installed massive solar arrays that are taking, its greenhouse gas emissions associated with the electricity generated and taking those down to zero through solar power. So that's one way. There are emissions associated with things very specific to the healthcare delivery system, like certain anesthetic gases that have very high global warming potential themselves, that are, most of them currently are released into the atmosphere from patients' bodies. And so there's systems to recapture, reclaim, or use alternative anesthetic gases that are of lower greenhouse gas potential. I'll say that's another area that's a huge area for R&D, is low greenhouse, low carbon potential medical equipment, medical gases, pharmaceuticals, et cetera. And then the whole area of telehealth and the provision of healthcare by reducing the transportation of patients is another area. So many different areas that are being looked at and used.
Mm-hmm. Thanks, John. We have a question about the work that you're doing as part of the UN SDGs, the Sustainable Goals. And since we are short on time, is there a section of your website where you address that?
So the office is not explicitly engaged in the sustainability development goals per se. That is a long topic. We are primarily domestically focused in our work, but we bring it to the COP26, to the UN world when it comes to sharing what we're doing in this country, and also we are looking to be able to through the COP26 health program and other means to be able to partner with other countries and share best practices and share the way that we're developing the targets and the progress to the goals. But we do not have anything right now that specifically addresses the SDGs. Thanks.
So something for you to be aware of, but you may already be a potential resource. Boarded occupational and environmental medicine physician has written in, just to make sure you know that there's a new environmental health section, and they could be a group in the medical community that could work with you. Great. We're looking for any and all partners, and folks should just contact us directly. Great. And this is from one of our researchers. Will medical researchers be able to include their lab sustainability initiatives and best practices in their applications for federal grants? Is that something that has been discussed, already exists, something that we might want to work on? It is absolutely something that has been discussed. I come from NIH. I spent 12 years working there, and we've been in conversations. My former institute, or my current institute, the National Institute of Environmental Health Sciences, has been a leader in sustainable laboratory practices. We are working. There's a translation step from developing those best practices and giving guidance to kind of incorporating them into grant language. That is part of our Climate Adaptation and Resilience Plan, Priority 3, specifically talks about updating policy, grant policy and grant guidance to incorporate sustainability and resilience. And so the short answer is yes, we're on a path to it. It's a path that it would be great to have partnership of Research America and working towards that path. Well, to that end, that's a great way to wrap up. We do want to be helpful, and so do our member organizations. In fact, one of our audience questions was, how can organizations on today's call work with you to address climate health? So yeah, let's talk about that, whether it's in the appropriations, and I know you come out and ask us for help, but what are some other ways that the research advocacy community can be of assistance? We welcome direct communication, input, and feedback. One primary venue for this kind of partnership is with the National Academy of Medicine and the Action Collaborative on Decarbonizing the Health Sector. It's called the Action Collaborative on Decarbonizing the Health Sector, but they're very much involved in community resilience, in health equity, in training and education. It's a pretty comprehensive network, and there's it's called a network associated with that Action Collaborative that is open to membership in a way to give input and to participate in that way.
it is a big topic. It's hard for a small office like ours to be able to have direct communication and communication with all groups. But again, one of the ways in which we're trying to reach national scale engagement is through our HHS regional offices, which all have health equity coalitions. They all have, they're starting to have summits on climate change and health equity that we're partnering with them on, that bring together the subnational governments and also academic groups and community organizations. So kind of connecting in through a regional approach is the other way that I would recommend.
John, that's great. I mean, HHS has had regional offices for a long time, and I think that's often an overlooked feature of the agency. So, and I know those are available on the HHS website. So that's
it is, and what we're seeing, and what's very exciting is the regional office is headed by a very small number of people through the Office of the Administration, the Assistant Secretary for Health. But the big operating divisions have very strong regional presence: preparedness and response, the Administration for Children and Families, Administration for Community Living, and we're seeing more and more connection at the regional level among the divisions of HHS to address health equity broadly and climate change and health equity specifically.
We could go on, John, and I'm impressed that so many people have stayed with us, long past our end time. But that's of credit to you and the work that you're leading, and our Alliance members, commitment and engagement in that work. So I'm going to say a quick goodbye to you, and I've got a really brief announcement. We are very excited about our annual National Health Research Forum, which is next month, September 19th to the 21st. We've got an incredible lineup of speakers and topics, and a link to register is in the chat now. So, I know a lot of us are zoomed out, but you can join us for 1, 2, 3, or more sessions. It doesn't have to be a major time commitment. You can weave in and out of this incredible group of experts and leaders that we've assembled for our forum. So thanks all of you for joining us today and for your really great questions. And we look forward to seeing you at our next Alliance member meeting. Thank you.
Thank you again, Jenny, and thanks everybody for joining today.
Thanks, John.